Hey there, my name's Jason and I've been specializing in treating OP exclusively for the last 8 years over Zoom and Skype. So let me explain why I find osteitis pubis to be a particularly useless diagnosis when it comes to getting better from this condition. So I get an email almost every week from a poor patient who will basically say something along the lines of, I just watched your testimonial with so-and-so and I have the exact same story and the exact same pain and the exact same experience. I have pain in my adductors or my pubic bone or some area that's around and connected to the pelvis. And they'll then say something along the lines of, I don't have a diagnosis, can you still help me? And to me, this is just such a sad state of affairs because this person could have been getting help years ago had they just gotten this diagnosis. And let me explain why this is such a problem. So from my perspective, osteitis pubis is a useless diagnosis because all it means is osteo means bone, itis means inflammation, and pubis means pubic area. It basically just says you have inflammation and pain down there. That's it. Doesn't tell us how to treat the problem, doesn't tell us what caused the problem, and without knowing these two things, what the hell are we doing? So let me elaborate a little bit more here. So when someone comes in and wants to engage with me, the first thing I'll have them do is send me a biomechanical assessment. And all that will do is they'll do a couple of simple basic tests where I will get to see how stable their pelvis is. And I'll be looking for very specific markers. Now, my skill set as a therapist is I am very, very good at making unstable pelvises stable. And this has to do with my understanding of how the whole body connects together and a bunch of other things you can see in other videos. But at the end of the day, I am treating that pelvic instability. So when they send me that assessment, I am looking to see if their pelvis is unstable. And my premise for the cause of OP is very simple. If your pelvis is unstable, you lift up your leg and your pelvis slides all over the place, you go to lift up an object and your pelvis becomes unstable and SIJ is unstable, well, that instability is going to put pressure on the joints, muscles, and tissues that attach to your pelvis. That extra pressure and overload is going to cause damage and pain, and that is going to be your experience of OP. That's it. Now, that can happen in lots of different ways when it comes to osteitis pubis because the pelvis attaches to a lot of things. So some people get very dominant adductor pain, some people get pubic bone pain, some people get lower core pain, some people get lower core and back pain, some people get sit bone pain, some people get a lot of pelvic floor pain. All these areas are very strongly connected to the pelvis. So if the pelvis is unstable, you will get symptoms along these lines. The issue is that diagnosis is not as nuanced. So you're assuming that a diagnosis definitely guarantees that you have this problem, and it might. But before MRIs were standard about 10 years ago, OP was strongly diagnosed by just using orthopedic tests. These tests tested the adductors primarily. So if you had lower core OP or pelvic floor OP or pubic bone dominant OP, bad luck. You got missed out. You didn't get the diagnosis of OP. Now MRI is the gold standard. So it's very, very good at picking up at dysfunction at the pubic bone level. Great, except not great. If you have adductor problems but no pubic bone issues, you have lower core problems but no real pubic bone issues, you're not going to get the diagnosis. Does that mean that someone couldn't help you by using the same protocol and treatment to fix OP? No, of course it would help. It's just that they've changed how they diagnose it. So again, OP becomes this useless diagnosis because it's just not used particularly well. And from my perspective, someone will come to me, they will show me this biomechanical assessment, and I go as a therapist, I go, my skill set, I'm good at treating and stabilizing pelvises. This person is asking me for something. They're going, I want to run a marathon, I want to play basketball, I want to play with my kid, I want to do these things pain-free, and the pain in my pelvis is preventing me from doing the things I really want to do. And I need to go as a therapist, does my skill set, my ability to make a pelvis stable, fix this issue? If it does, great, I can help you, please sign up, let's get going. On the flip side, sometimes I can't help a person. So let me play devil's advocate here a little bit. Very occasionally, let's say 1 out of 100 patients, they will come to me and they'll be like, I got the diagnosis, here's the MRI results, and I'll read the report and I'll be like, great, don't care, send me a biomechanical assessment, I need to know what I'm treating. So they'll send me their assessment and they'll lift their leg up, they'll do the tests, and I've seen 100 million OP patients, and I'll go, this is weird. Their pelvis is really stable. They're not shaking, they're not shifting, we're not seeing the sacroiliac drop here. What is going on? And then I'll ask them a few more questions, and it'll turn out that they have had this pain for a really long time and that there's been some dietary issues or they've had some sort of hormonal issues and stuff like that. And all of a sudden a picture will start to emerge where I will go, yes, you have a diagnosis from an MRI that says you have inflammation down here. Great. And they've given you the diagnosis of osteitis pubis. Great. But I don't think your osteitis pubis is caused by mechanical issues. I don't think it's caused by bad movement patterns. Firstly, my skill set as a therapist to fix movement patterns isn't going to help you. Your pelvis is already stable. Therefore, I don't think that engaging in OP rehab is going to help you. I actually don't think physical therapy is going to help you. And believe it or not, OP is so interconnected to so many issues that occur in the pelvis that it can be internal, that I will go, hey, I think you might be better off going and getting a diagnosis to check, if you're a woman, whether you might have endometriosis. This is really strongly connected with OP. And the inflammation caused by endometriosis can cause the kind of symptoms and pathology that you see in OP. Please go get that checked out. I think that might be more useful for you. I think you might have some dietary issues and stuff like that. That dietary issues is creating a complex set of interactions in your body that leads to a situation where you're getting inflammation in your pubic bone. And I can get into that in another video. It's very complex, but I don't think, again, movement patterns are going to help you here. I think you're looking down the wrong tree. A physical therapist isn't going to help you here. You need a dietitian. You need to go get your microbiome tested. And then there can also be issues with stress and anxiety and the way that you hold stress in your body and a whole host of things you wouldn't believe me if I got into details with that I have seen over my career in treating this condition. But the premise being the same. I tested your mechanics. My skill set can't help you. Or I've tested your mechanics. They're really, really bad. Your pelvis is unstable. I can stabilize your pelvis and take away your pain. At the end of the day, the MRIs and the diagnoses aren't useful because for me as a therapist, I don't interact with them. They don't tell me how to treat you. They don't tell me why you have your condition. All they say is that you have inflammation down here. Not particularly useful. So I would strongly associate, not particularly useful. I would strongly encourage you to really disassociate yourself from this notion that you need a diagnosis in order to get better from this, and that this diagnosis, OP, are all the answers that you're looking for, because it's not. And when you are trying to get therapy and treatment for this condition, I would really try to encourage you, and this is the premise of all my videos, to educate yourself and to be logical and methodical. When you're engaging with a therapist, they are going to provide a skill set. You need to analyze your situation and go, will that skill set lead to the outcome that I want? Is the things that this person is saying making sense? And will they therefore get me the things that I'm trying to achieve? And if they are failing to meet that test, if I'm failing to meet that test, then we or I are not the therapist for you. And you need to find someone that's going to get you close to your goals. You need to take control of the decisions in this situation, and you need to educate yourself and make sure that you're putting yourself in the best position in order to recover from this incredibly complex and difficult injury. The dominoes